This is The Spirit of Ecstasy. I'm going to be reviewing some of my favorite medical books this evening. I hope I have some of them that you really enjoy. You'll be able to enjoy them as much as I do. And I've got them in a basic survey here of some books. Stuff around here where make sure they can be seen. Okay. Okay, we have a clinical hemostasis and fundamentals, clinical hematology and fundamentals of hemostasis, prescription medicines, side effect and their side effects, and natural alternatives. Sausage urine, Fortran's gastrointestinal liver diseases, genetics in medicine, Saberson's review of surgery, basic biochemistry, Mark's basic biochemistry, a clinical approach, textbook of veterinary physiological chemistry, Larry R. Engelking, PhD, Introduction to General Organic Biochemistry in the Laboratory, Hein, Passon, and Richley, Duane E. Haynes, Neuroanatomy and Atlas of Structures, Sections, and Systems, Essentials of Clinical Neuroanatomy and Neurophysiology by Gilman Newman. And this one is very, very good here on pathophysiology. But it's a more simplified book than is Robbins, but it's a very, very good book. Good illustrations. It's Porth, P-O-R-T-H, Porth Essentials of Pathophysiology, Concepts of Altered Health States. And then got medical microbiology, and then Essentials of General Surgery. Gross Anatomy, that's another one of the board preparation series for USMLE. Which is covers gross anatomy, He-Young, Wong Chung, and then a book on somatics, which covers mind-body connection, psychosomatics. Okay, gross anatomy, general surgery, gross anatomy, somatics, covers mind-body connection, and then molecules of the mind, which also is mind-body connection, psychosomatics, and internal medicine by Harrison's. Okay. That will give a general rundown. Okay, and then I got these two here, which won't show up in that. This is a very good laboratory manual here. Laboratory for Anatomy and Physiology. Allen. And Benson's Microbiology. Laboratory Manual in General Microbiology. Comes in loose leaf. And then I want to continue on with my review of Merck's manual. Has all kinds of good illustrations in it. This is Merck manual. Okay. Well, the first section's on infectious diseases. They cover anti-infective drugs and abscesses, retroperitoneal abscesses, anterior retroperitoneal abscesses. And as I said, they break it down symptoms, which is real good, in symptoms and signs, diagnosis, prognosis, and treatment, and etiology. They give you the etiology of the visceral abscess, etiology, and then the symptoms and the signs. They do that on all of the areas, then the symptoms and signs, and then they go from that into the complications and treatments and diagnosis, complications and treatment, and do that on each area. Hepatic abscesses, etiology and pathogenesis, symptoms and signs, diagnosis, complications, prognosis, and treatment. And so, you know what to expect on each one, where you look for what you're trying to find. And on this one, they have the laboratory findings also on some of them. They put your laboratory findings. Yep. It seemed to make that work. I guess we're not going to get that particular one in there. One more thing. Try going this way. Okay. There it is. At the onset of shock, the leukocyte count may be significantly reduced and the polymorphonuclear leukocytes may be low as 20%, and so on. Gives you all that. Urine-specific gravity, even more so, osmolarity is helpful in distinguishing between hypovolemia and sepsis. Gives you all those kinds of good things like that all the way through it. And gram negative, gram positive. Bowel syndromes caused by adenoviruses. Lymphocytic choriomeningitis. not figure what it is that's causing the difficulty. Move it that way. There we go. Well, it might be a little better. Yep. Just keep trying. And get that light on there enough to... There we go. Let's get some better. Diseases of uncertain etiology. Symptoms and signs. Okay. Let me see. Pneumonia caused by Haemophilus influenzae. Influenza. Pneumonia of Legionnaire's disease. Infectious gastroenteritis and of uncertain etiology. Cholestasis. More charts such as this. Bone and cartilage disorders. Lower urinary tract. Chronic bacterial pyelonephritis. Lower urinary tract and male genital tract infections. Neonatal conjunctivitis. Acute infectious neonatal diarrhea. Intersex states. Heart and nut disease. And then we have this section on injuries and poisonings and resuscitation. Gives you all different kinds of lead poisoning, snake bites, everything. Viral infections. Very good charts on everything. Generalized exfoliative dermatitis, and so on.